Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. Cases of COVID-19 are on the rise again, especially globally, of course, with the Omicron variant steadily finding its way into pretty much every country in the world right now. It's already by far and away the dominant variant in the United States and parts of Europe, with both regions seeing this recent explosion in new Omicron infections.
And despite being into year 3 of this pandemic, the ramifications of it remain real, and what happens in the years to come is anyone's guess, but even the most optimistic would say it's unlikely to be good, socially, economically, or politically. For more on where we stand in relation to the pandemic, we're joined by Ben Cowling, Chair Professor of Epidemiology at the University of Hong Kong. Good morning, Professor.
Good morning.
So, Professor, despite all the resources and money the pandemic caught the world off guard, have international health institutions dropped the ball, or are they doing the best they can in this current bad situation?
I think the next few months are going to be tough, with Omicron challenging many different parts of the world, as you mentioned. Hopefully, after we see the end of Omicron, after we see the numbers coming down again, I think a lot of countries are going to begin to see the light at the end of the tunnel, maybe the end of the pandemic getting closer and closer. I know we said this 6 months ago when it looked like Delta was potentially coming to an end, but I think with Omicron having posed an even bigger threat than Delta, hopefully when Omicron's done, we'll be able to say it's the end of the pandemic and be able to move into a more epidemic phase. And that means an end to much of the government measures. And also it means time for a review of what worked, what didn't work, which countries did better jobs, which countries didn't do so well, and how did the WHO do? And I think that would be fascinating to really compare and contrast what's worked and what hasn't worked.
Yeah, it's going to be very interesting to look back at this pandemic in a number of years' time, whenever it's finished. But as we all know, in many developed countries, including South Korea, the UK, where you are now, people are on their third, even fourth COVID-19 shot in certain circumstances, while poorer nations either have none or have received very few. This is now year 3 of this pandemic. So who do you think bears the most responsibility for this inequity? And if anything, is there something that can be done to rectify it?
I think it's very clear that the majority of vaccine doses have been administered in the more resourced countries, the more developed countries, and there hasn't been so much vaccine available in less developed countries. And that's really a big issue, I think. I know the World Health Organization had a COVAX program where they wanted to get donations of vaccines and give a lot of vaccines to developing countries, but that hasn't worked as well as I think it was hoped. And the numbers of vaccines donated weren't as high as thought. And there were also quite a number of issues with delivery of vaccines of certain types and then getting it into people's arms. And now it's 2 years into the pandemic. Much of the world, much of the developing world has had COVID epidemics, sometimes multiple epidemics, and maybe vaccines won't do as much good now as they would have done 6 months ago, but they can still do some good. And I think it's still important to proceed with this global distribution of vaccines and make sure that everybody in the world has a chance to get vaccinated if they want to.
And Professor, we're seeing Omicron spreading like wildfire since the beginning of this year. It's already the 4th or 5th variant to emerge. Do you see even more strains popping up in 2022? And if so, what's the best scenario we can hope for?
I think it's likely that we will have more variants in the future. I know that Omicron came as a bit of a shock. It came out of the blue. I hope that in the future, the variants won't be as different as Omicron is with so many mutations. But it's very difficult to predict what's going to happen in the future. As we've seen, I think Omicron came out of the blue. Maybe there'll be another one as well in the coming year. So I'm reluctant to say, what might or may not happen. But regardless of what variants come in the future, I think we'll see less and less public health impact of COVID as time goes on because of the immunity that's now been built up, mainly through vaccines, but also in some places through natural infections. And I think that means in the future, COVID won't pose as much of a threat, even when these new variants emerge.
Okay, well, that's good news. Finally, away from vaccines, How do you see the rate of speed at which anti-COVID treatments have been developed and distributed? And is what we have right now, do you think, sufficient enough to treat the sick, or does more research need to be done?
Oh, I think it's fantastic news. I just saw your report that you're going to get a whole load of the Pfizer antiviral drugs being available from mid-January onwards. That's really great. And I think 2 years into the pandemic, having an effective antiviral like that is wonderful news. But that drug is mainly for mild cases, maybe mild cases in people who could have a higher risk to progress to severe disease. What we don't have still are treatments for people who end up in hospital with severe COVID, and that's the first time they're seen by the healthcare system. What's the best treatment for people who present at hospital with severe disease? And that would be still a gap for future development of effective drugs, whether it's antivirals or other kind of medicines. But I think we're in a good place now compared to where we were a year ago.
All right. Professor Cowling, we appreciate you joining us. Thank you always, as always, for your insights.
Thank you.